Best Mental Health Software of 2026. Welcome to part 4 of our 10-part series on the best healthcare software in 2026. In this episode, it's all about mental health software. The platform's designed specifically for behavioral health, psychiatry, therapy, and substance use disorder treatment. We'll cover what matters, as well as some of the best options for small practices and larger health organizations. But before we dive in, this video is sponsored by several healthcare software leaders, including our title sponsor, athenahealth, as well as our other sponsors and partners, NextGen, drchrono, CareCloud, and TotalMD. What a stellar group of platforms. You can learn more about each of them through the links in the description, and stick around to the end for more resources. Alright, let's dive in. Best mental health software for small practices. For solo therapists, small group practices, and independent psychiatrists, mental health software is the entire administrative and clinical infrastructure of the practice. It has to be affordable, easy to use without IT support, and specifically designed for behavioral health, not a general EHR with a behavioral health module bolted on. The best small practice mental health platforms handle the billing complexity of behavioral health, mental health CPT codes, insurance carve-outs, payer authorization requirements for behavioral health, and the billing rules that differ from medical billing, all managed natively. Support telehealth natively. Virtual visits are now a core part of how behavioral health is delivered. The platform should support video visits with documentation that flows into the same chart as in-person sessions. Reduce documentation burden. Session notes, treatment plans, progress notes, and outcome measures should be fast to complete, because clinician time spent documenting is time not spent with patients. Stay within reach financially. Solo practitioners and small groups can't absorb enterprise software costs. Per clinician pricing with no long-term contracts is important. Prioritize compliance. For practices treating substance use disorders, compliance with stricter privacy protections governing SUD records, such as 42 CFR Part 2, is critical. Here are several mental health platforms consistently chosen by smaller practices. Note, these are listed alphabetically. Screenshot and return to this list later, then set up demos. There are also links in the description for detailed feature breakdowns in the Select Hub platform. There you go, some of the best mental health software options for smaller practices. Before we move on, a quick shout out to our title sponsor, athenahealth. Unlike systems that bolt together separate modules, athenahealth, whose Athena One solution provides EHR, practice management, and revenue cycle management, serves medical practices and health systems in one unified system. Their single instance network of over 170,000 clinicians and 117 million patients gives them a scale that's hard to match in ambulatory care. Plus, Athena One is AI native from the ground up. The platform brings AI into the workflows that power ambulatory care, helping practices deliver care, manage revenue, engage patients, and run more consistent day-to-day operations through one connected platform. Thanks to athenahealth for supporting this series. Check them out through the link in the description to see if Athena One is the right fit for your organization. Now, back to the show. Best mental health software for larger organizations. Larger behavioral health organizations, including community mental health centers, multi-site outpatient programs, residential treatment facilities, regional behavioral health networks, and more, need platforms that handle the clinical and operational complexity of serving large, diverse patient populations under value-based contracts and government funding requirements. Mid-market and enterprise mental health software buyers typically look for multi-program support, outpatient therapy, intensive outpatient, partial hospitalization, substance use disorder treatment, and case management are often running simultaneously within the same organization, each with different documentation and billing requirements. Outcome tracking and reporting. Standardized outcome measurements tracked over time at the patient and population level, essential for value-based contracts, grant reporting, and accreditation. Group therapy documentation. Group note workflows that allow clinicians to document a single group session and generate individual notes for each participant efficiently. Medicaid billing expertise. Community behavioral health organizations are heavily Medicaid dependent. The platform must handle state-specific Medicaid billing rules, prior authorization requirements, and encounter-based reporting. Care coordination tools. Case management workflows, referral tracking, and integration with social determinants data that support holistic care for patients with complex behavioral and medical needs. Regulatory compliance across multiple states. Enterprise behavioral health organizations operating in multiple states face a patchwork of state-specific regulations regulations on telehealth, prescribing, and documentation. The platform must handle that variation. Workforce and caseload management, tools for managing clinician caseloads, productivity, and scheduling across large behavioral health workforces, including both employed and contracted providers. Here are several platforms often chosen by mid-market and larger behavioral health organizations. Again, screenshot this list, and there are links in the description for SelectHub's feature-by-feature comparisons and analyst scores. A little extra research could save you significant time and resources. Again, links to the SelectHub platform are in the description. There you have it, an overview of some of the best mental health software in 2026, from small practices through to larger behavioral health systems. For more resources, including pricing guides and SelectHub's database of feature comparisons, check out the links in the description. One more big thank you to the sponsors who made this series possible, including our title sponsor, athenahealth, as well as our other sponsors and partners, NextGen, drchrono, CareCloud, and TotalMD. Each of these brings unique value depending on your organization's size, specialty, and patient population. Links are in the description. I'm Devin Hennig with SelectHub. Thanks for watching, and we'll see you next time. Cheers!